Understanding the Female Genitourinary System for Nursing Students. Introduction. Hello and welcome to this presentation on the Female Genitourinary System. In this presentation, we will discuss the anatomy and physiology of the female genitalia, developmental competence for newborns, school-aged, adolescents, and pregnant women, impacts of pregnancy, hormonal changes with aging, and performing a physical assessment. Section 1. Anatomy and physiology. The female genitalia consist of internal and external structures. The external structures include the mons pubis, labia majora, labia minora, clitoris, vaginal orifice, and hymen. The internal structures include the vagina, cervix, uterus, fallopian tubes, and ovaries. The vagina is a muscular tube that extends from the cervix to the vulva. The cervix is the lower part of the uterus that opens into the vagina. The uterus is a muscular organ that is responsible for nurturing and supporting a developing fetus. The fallopian tubes are responsible for transporting the egg from the ovaries to the uterus. The ovaries produce estrogen and progesterone and are responsible for the production and release of eggs. Section 2. Developmental competence. The Tanner staging system is used to assess the developmental stages of the female genitalia. Newborn females may have a small amount of white vaginal discharge or bloody vaginal discharge, which is a result of the withdrawal of maternal hormones. School-aged females, Tanner stage 2, may start to develop breast buds and pubic hair, which is the beginning of puberty. In Tanner stage 3, pubic hair becomes more coarse and curly, and breasts continue to develop, with the areola and nipple forming a separate mound. In Tanner stage 4, the areola and nipple form a secondary mound, and the breast is almost fully matured. In Tanner stage 5, pubic hair becomes adult-like and spreads to the inner thigh, and the breast is fully matured. Adolescents, Tanner stages 3 to 5, may experience menstrual cycles and may start to have sexual intercourse, which can increase their risk of sexually transmitted infections. Pregnant women may experience significant changes in their bodies, including an increase in vaginal discharge, breast tenderness, and enlargement, and a change in the position of the cervix. Section 3. Impacts of pregnancy. Pregnancy can have significant impacts on the female genitourinary system. The growing fetus can put pressure on the bladder, which can lead to urinary frequency and incontinence. Pregnant women are also at an increased risk for developing gestational diabetes and preeclampsia. Section 4. Hormonal changes with aging. As females age, their hormone levels decrease. This decrease in hormones can lead to vaginal dryness, decreased libido, and changes in menstrual patterns. The decrease in estrogen levels can also lead to osteoporosis. Section 5. Performing a physical assessment. Normal and abnormal findings. During a physical assessment of the female genitourinary system, it is important to gather both subjective and objective information. Objective findings may include a visual examination of the external and internal structures, a pelvic examination, and a pap smear. Here are some normal and abnormal findings that can be observed during a physical assessment. 1. Pediculosis pubis. Crab lice. Pediculosis pubis, also known as crab lice, is a parasitic infestation of the pubic hair. The presence of nits or lice on pubic hair is considered an abnormal finding during a physical assessment. 2. Herpes simplex virus is type 2. Herpes genitalis. Herpes simplex virus, HSV, is a viral infection that can cause painful blisters or ulcers in the genital area. The presence of ulcers or blisters on the vulva or vaginal mucosa is considered an abnormal finding during a physical assessment. 3. Syphilitic chancre. Syphilis is a sexually transmitted infection, STI, caused by the bacterium Treponema pallidum. The primary stage of syphilis is characterized by the presence of a painless, firm, round ulcer, called a chancre, on the genitals. The presence of a chancre on the vulva or vaginal mucosa is considered an abnormal finding during a physical assessment. 4. Red rash. Contact dermatitis. Contact dermatitis is a type of skin inflammation that is caused by contact with an irritating substance. A red rash on the vulva or perineal area can be an abnormal finding during a physical assessment. 5. HPV warts. Human papillomavirus, HPV, is a viral infection that can cause warts on the genitals. The presence of warts on the vulva or vaginal mucosa is considered an abnormal finding during a physical assessment. 6. Urethritis and UTI. Urethritis and urinary tract infections, UTIs, can cause discomfort or pain during urination, as well as an increased frequency of urination. The presence of pain or discomfort during urination, or a positive urine culture, is considered an abnormal finding during a physical assessment. 7. Abscess of Bartholin gland. Bartholin gland abscess is a painful swelling that can occur on one side of the vaginal opening. The presence of a painful swelling on one side of the vaginal opening is considered an abnormal finding during a physical assessment. 8. Urethral caruncle. Urethral caruncle is a small, benign growth that can occur on the urethral opening. The presence of a growth on the urethral opening is considered an abnormal finding during a physical assessment. 9. Abnormalities. Pelvic musculature. Pelvic musculature abnormalities, such as cystocele, rectocele, and uterine prolapse, can cause pelvic pressure or discomfort. The presence of pelvic pressure or discomfort during a physical assessment is considered an abnormal finding. 10. Cervix. Abnormal findings on the cervix during a physical assessment can include bluish cervix, cyanosis, erosion, HPV, condylomata, polyp, diethylstilbestrol, DES, syndrome, and cervical cancer. These findings are considered abnormal and may require further evaluation or treatment. 11. Vulvovaginal inflammations. Abnormal findings in the vulvovaginal area during a physical assessment can include atrophic vaginitis, candidiasis, monoliasis, trichomoniasis, bacterial vaginosis. In conclusion, understanding the female genitourinary system is essential for providing optimal healthcare to females. Developmental competence for newborns, Tanner Stage 1, school-aged, Tanner Stage 2, adolescents, Tanner Stages 3 to 5, and pregnant women, impacts of pregnancy, hormonal changes with aging, and performing a physical assessment are all important aspects to consider. We hope this presentation has been informative and helpful in your nursing education.